My name is Sara Thomas, and today I am going to show you 3 different inhibit techniques. The first will be for the calf muscle, the second will be for the hamstring complex, and the third will be for the piriformis. A couple things to remember when using the hypervolt is that it has 3 different levels, and it is important to choose a level in which your client will feel comfortable. The second is the head has different attachments, and so finding one that will be most comfortable for your client is really important. So for the calves and the hamstrings, I will use the flat head, and we will begin. So what I'm going to do is I am going to work the length of the muscle, moving the hypervolt from all the way down, all the way to the top, very slowly. So this particular technique I will do for 1 minute in this particular area, stopping if my client mentions that there's a tender spot. And if there is a tender spot, I will hold it in that position for 30 seconds. Let me know if there's any tender spots.
Mm-hmm.
Right there.
Mm-hmm.
Okay. So I'll hold it here for 30 seconds to allow that muscle to fully relax before moving on. I would, of course, do both the right and the left leg with that same technique. So moving on to the hamstrings, I will do, in essence, the same thing, moving the length of the muscle, making sure that my client lets me know if I get to a tender spot. I want to make sure that I'm moving not only the length of the muscle, but also medially and laterally to cover the entire complex. If I get to a tender spot, I will just hold it there for 30 seconds. Being sure that I'm moving slowly, so to fully target that whole complex. And if there's no tender spot, I will spend about 60 seconds on this leg before moving to the other leg. And lastly, we will focus on the piriformis. For this particular technique, I will change the head to get deeper into the muscle. Because the glute muscle is a large muscle, this will allow me to get a little bit deeper and focus on that particular area. So using the same technique, I am just going to apply a fair amount of pressure, making sure that I'm staying away from any bony areas within the hip. If my client feels any tender spot, it's important that he lets me know so that I can focus in that area for 30 seconds. Was that one right there?
Mm-hmm.
So he has identified an area. So I'm just going to allow the hypervolt to stay in that area for 30 seconds. And I will spend about 60 seconds on this side, and I would do the same on the opposite side. I want to make sure that I just work the hypervolt around that whole piriformis area stopping on any tender spots. Those three techniques are focused on the posterior side of the body. Thank you very much.